Dear students, welcome back. In the previous session, we have discussed about gluteal region. Now in this session, we are going to discuss about back of the thigh. Back of the thigh or posterior thigh is the region on the posterior aspect of the thigh which is extending from the lower border of the gluteus maximus, okay, to the upper limit of popliteal fossa. So this one is actually, this is the popliteal fossa you can find here. So this is the upper limit of the popliteal fossa. So this is the extension of the back of the thigh or posterior thigh. So this is the region on the posterior aspect of the thigh that extends from the lower border of gluteus maximus to the upper limit of popliteal fossa. Okay, vessels and nerves of the back of the thigh mostly continue down from the gluteal region. So the nerves and vessels which are continued from the gluteal region and then to the back of the thigh. Okay, and this one is going to continue to the lower part of the posterior aspect of the leg also. Okay, now if you see the fascia of the back of the thigh, the superficial fascia has no any special feature. The deep fascia deserves a special mention here. It is composed of circularly disposed fibers which are not only densely packed but are very strong. So the deep fascia which are present on the back of the thigh or disposed in fibers and also densely packed which are very strong. Okay, so closer to the lower end of the posterior thigh, the fascia functions like a virtual retinaculum restraining the tendons of the hamstrings from falling off. So here at the lower part of the posterior thigh, these fascia functions as a retinaculum which helps in the restraining the tendons of hamstrings from falling off. Okay, and if you see the contents of the back of the thigh, so the contents of the back of the thigh mainly consists of hamstring muscles. So hamstrings. This hamstrings mainly consists of three muscles. Okay, one is semitendinosus, semimembranosus, and biceps femoris. The name itself indicates that it is having two heads. One is long head and short head of biceps femoris. But in under hamstrings, only long head of biceps femoris forms the hamstrings. Okay, and also it also consists of a short head, isn't it? Short head of biceps, which is not a hamstring, but we can consider this short head of hamstring as lateral hamstring because of its insertion. We can consider this short head of biceps as lateral hamstring. And also another muscle which includes in the back of the thigh is ischial head of adductor magnus. So normally on the posterior aspect we can find this ischial tuberosity, isn't it? So that part which is getting originating at the ischial tuberosity of the adductor magnus, we can consider that part. Only ischial head of adductor magnus. Ischial head of adductor magnus. Adductor magnus we have already finished. Okay, and next coming, these are all the muscles which are present on the posterior thigh. If you see the nerves, the main nerve which is present on the posterior aspect is the sciatic nerve, and the next nerve is the posterior cutaneous nerve of thigh. If you see the vessels, the main vessels or the branches which are coming from profunda femoris artery, which is a branch of femoral artery. Okay, and normally this femoral artery mainly present on the anterior aspect, but at the branch of femoral artery, that is profunda femoris artery, gives branches to the posterior part of the, that is posterior part of the thigh. Okay, and if you take the vein, it also includes the accompanying the veins which are accompanying the arteries, that is profunda vein. Okay, so these are about the vessels. What are the vessels? Branches of profunda femoris artery and profundus vein. So venous drainage. What are the nerves? Sciatic nerve and posterior cutaneous nerve of thigh. So these are all the contents of the back of the thigh. So what are the main contents? So it includes hamstring muscles, mainly includes semitendinosus, semimembranosus, long head of biceps. And next muscle is the short head of biceps. And next muscle is the ischial head of adductor, Magnus. And if you see the nerves, sciatic nerve and posterior cutaneous nerve of thigh. And if you see the vessels, profunda femoris artery, branches of profunda femoris artery and profunda vein. So this sciatic nerve and posterior cutaneous nerve of thigh originates from the sacral plexus. Okay. We are going to see the sciatic nerve separately, and if you see the posterior cutaneous nerve of thigh, it is derived from the anterior and posterior divisions of the anterior rami of S1, S2 and S3 spinal nerves. So now we will move on to the main muscles of the back, that is hamstring muscles. Now we will see its origin, insertion and its nerve supply and action. So one interesting thing about these hamstrings, all these hamstring muscles have a common function. Okay, so first, as we all know that hamstring consists of three muscles: semitendinosus, semimembranosus and long head of biceps. Now we will see its origin for semitendinosus. So here comes the semitendinosus. So it is originating from the upper medial part of ischial tuberosity. So we have studied in the osteology. So this one is the ischial tuberosity seen from below, and it is divided into three parts. One is by transverse division and lower end by what you call as longitudinal division. Okay, and if you see upper medial part of the ischial tuberosity, this semitendinosus is getting originated. Okay, and if you see the insertion, it is going to insert on the medial surface of the tibia, and it is getting inserted in the medial surface of the tibia behind the sartorius muscle and below and behind the gracilis. And this one is supplied by the sciatic nerve, the two tibial part of the sciatic nerve. If you see the action, so we are going to see all this action all together. Okay, this is about the origin, insertion and nerve supply of semitendinosus. Now if you see the semimembranosus, so it is originating from the upper lateral part of the ischial tuberosity. So it is originating from upper lateral part of the ischial tuberosity, and it is getting inserted into the medial condyle of tibia, and it is supplied by the sciatic nerve, the two tibial part. Okay, now if you see the biceps femoris, So for long head, here we can see the long head. The long head arises from the upper medial part of the ischial tuberosity, as well as the sacrotuberous ligament. And short head of biceps, here you can see the short head of biceps will get originating from linea aspera of the femur. So both these heads end in a common tendon. That is attached to the head of the fibula. So here one interesting thing near the insertion. So these two tendons which are united, and we can call it as a common tendon, which is inserted into the head of the fibula, isn't it? So that is the insertion. Just above the insertion, the tendon splits into two parts that embrace the fibular collateral ligament. So this is one interesting aspect of this insertion. When the knee is flexed, the biceps femoris produces a limited lateral rotation of the leg because of this thing. And this one is supplied by the sciatic nerve, that is tibial part of the sciatic nerve supplies the biceps femoris muscle. If you see the actions of all these muscles, so these are all called as hamstring muscles, and all these having a common function. One is the flexion of leg at knee joint. So it helps in the flexion of the leg at knee joint when pelvis is fixed. When the knee is fixed as it's standing, the ischial tuberosity is pulled downwards, and this is useful in preventing the pelvis from rolling forwards on the head of the femur. And also these muscles helps in the straightening the trunk after bending forwards. So that means this hamstring muscles which helps in the extension of the hip joint also. Okay, so these are all the actions of the muscles of the back of the thigh. In the next session, we are going to discuss about the sciatic nerve. Thank you.